Apart from screening, we are making sure that after screening and after the cards are distributed, the patients who are found to be diseased, they get quality care, they are put on treatment, and counseling becomes very important. Not just for patients, but also for the support groups, but also for social organizations. So that is something which we are encouraging the states to hold for all the SED affected patients and their families. And you also understand that creating awareness is very important because a large number of people in the country still don't know about the disease. They don't know what's the difference between a carrier and a disease. There are mothers who don't know whether they're actually carriers. And a lot of families, they do not want testing, they do not want to go for screening because there is immense amount of stigma associated with the disease. So this hinders testing. So IEC efforts are very important to break down these stigmas, to educate people, and to provide them the moral support so that they undertake screening exercise, they cooperate in the screening exercise, for which we are rigorously training our frontline health workers in the states, or the union government and state government. We are working together to make sure that our ASHAs, ANMs, who are actually given the task of screening, they are rigorously trained and they are able to provide compassionate care in the remotest of areas. And there is mandatory screening which is being carried out at our primary healthcare facilities and the Ayushman Arogya Mandirs today. There are mobile health vans which are specially deployed in the tribal areas so that people have access to screening facilities. So all these efforts are being undertaken because we want to create a sickle cell disease-free India by 2047. And here, everybody's role becomes important. So it is the civil society, it is the doctors, it is the patient advocates, it is media, it is policy makers. Everybody's effort becomes important because it is a collective goal. And we all need to work together. Ministry of Health and Family Welfare has come up with an SED portal also. So every patient who's being screened and identified as carrying the disease is registered on the portal. And there is a treatment and follow-up module that we have developed so that the continuity of treatment and management for those patients who are registered on the portal is maintained. All that exercise is being carried out.